Today I'm going to be talking about lower back pain in pregnancy, which is a common complaint. I was interested in this topic because I suffer from hyperlordosis, which I'm given a lot of memes about on Instagram. This is an example, and hyperlordosis is the second picture on this meme, incorrectly called lumbar lordosis here, but it's when you have an excessive curvature of your back, and it just leads to a lot of different back pain issues and postural issues. During pregnancy, you get actually more hyperlordosis, and you tend to have other postural issues like forward jutting out of the neck and things like that, and that's leading to abdominal muscles being stretched and the pelvic ligaments getting loosened. So because of all these different normal physiological changes, lower back pain is really common in pregnancy. Classic lower back pain affects like the lumbar area of the back. It's very common, about 60% of pregnant people have it. It's often exaggerated by activity and relieved by rest. It may radiate down one of the legs. You see in this picture that the sciatic nerve is right near in that lumbar area. So sciatica can be part of it. Pain is usually worse at night, especially with turning during sleep. So sleep issues are common. Risk factors are having pre-existing back pain, having been pregnant multiple times, high BMI. Another kind of back pain that's a little bit different is pelvic girdle pain. You see that the pelvic joints, some of them are like in the same area as where lumbar pain might be, like the specifically sacroiliac joint. So you can have pelvic girdle pain as well as what's considered normal lower back pain. You can have both. You can have one or the other during pregnancy. They feel kind of similar. They have slightly different triggers. Pelvic girdle pain can come more from like sitting for a long time or weight bearing. And both of these lower back pains can be managed pretty similarly. For management, ACOG has specific recommendations around like body mechanics and other things that you can do to kind of prevent and support your back. So like for example, wearing low-heeled shoes with good arch support, lifting with your knees, not with your back, sleeping on the side with a pillow between your knees, using heat packs, cold packs, massages, and using a safe medication for pregnancy like Tylenol. You can also use a belly band like the one in this picture to take some weight off your back. There's also some good exercises that ACOG recommends that I have here that strengthen the abdominal wall, and also can strengthen some of the back muscles as well to take some pain away, and that will help relieve the pain of doing pretty regularly. If all of these things haven't worked, it's really good to get referred to physical therapy for this. With back pain, things to think about for seeking immediate care: persistent pain that's not going away, severe pain. You might want to talk to a clinician also if you're having like weakness, tingling, numbness. That's new. Like that's could be a sign of a bigger neurological issue. Urinary incontinence is also a sign of a neuro issue. Pain with coughing or sneezing that's new. Another abnormal pain that should be looked at. Fever, chills, weight loss. If you're just feeling generally sick, you should go talk to a clinician. And also, if you have a new kind of pain where there's like it's cyclical and it feels different, this could be preterm labor, but it could be showing up in your back. So it's good to kind of notice if the pain changes and look for also other signs of preterm labor and be seen by a clinician in that case. Okay, thank you.